Hello everyone, welcome to Module 8. We are slowly but surely getting to the end of this quarter. We have about 3 weeks left, really 2 more weeks of content after this week. So this week our learning objectives are going to be regarding that of orthopedics, physical therapy, and rehabilitation. So with that, let's go ahead and go into this. So by the end of this module, here's what you should be able to do. First and foremost, you should be able to explain range of motion and range of motion activities. That will include active, passive, and active assisted. So we're going to talk about each one of these individually within the lab, and then what I'm going to do is break you into different groups and have you guys not only demonstrate, but give some examples of some range of motion exercises. So we're going to be doing that in the lab this week. You should be able to demonstrate instruction on proper use of adaptive devices. So that's going to be things such as canes, crutches, walkers, and the use of wheelchairs. So again, we'll work with these in class. We'll have obviously a little bit of a lecture on this first, and then what we'll actually do is put you guys into groups and have you teach one another how to use those different adaptive devices. Demonstrate appropriate assistance with a gait assessment. So this is going to be using a gait belt to really help a patient learn and use the different types of walking mechanisms with that of a gait belt. So those of you who have been a CNA or have worked in that field in some sort, you are going to have a little bit of an advantage here. But don't worry, we're all going to get very comfortable using gait belts this week. Demonstrate the proper technique for transferring patients from wheelchairs to exam tables or chairs. So this is something we are going to work on because of the fact that there will be patients who come into our clinical setting and they are in a wheelchair or they're not able to really help themselves get from one place to another. So you as the MA are going to have to learn how to transfer them. So we are going to role play that out this week. Putting a patient from a wheelchair to an exam table. Properly utilize a physician's desk reference or a PDR, drug handbook, and other drug references to identify drug classifications, usual dosage, unusual side effects, and contraindications. This is going to come with your course project, and this will be the last week for your course projects. You will not have any for modules 9 or 10. So this will be the last week that we really work with that until next quarter, and we're going to spend a lot more time next quarter really working on medications and fully understanding different medications for each unit. And then develop traits of a professional medical assistant. So a lot of this is going to come when we do our weekly skills checks, so learning how to communicate with a patient, making eye contact, kind of having that little back and forth banter, or what we call soft skills, instead of just solely focusing on the task at hand. We're also going to learn and work with continuing blood draws, continuing injections, and really knowing those without me having to tell you if you're right or if you're wrong. And then lastly, you're going to have your CMA preparation. Now, just like what we did last week, I am going to have us do a prep test in class. It will not count for a grade, so it will not count for your PATH assessment, but it is a good tool for you to start really focusing on and getting serious about when it comes to the CMA exam. All right, guys, have a great week. I'll see you on Wednesday for class. Bye, everyone.